Hi, my name is Stephanie Hertz, Marketing Director at Workforce Retirement Community. Workforce is the premier sponsor of the Lifelong Learning Society, and we welcome you to the Riverside Lecture Series. Today's speaker is Kelsey Norton, a founding member of Riverside Behavioral Health Center's Addiction Services located in Hampton, Virginia. There she serves as a residential inpatient detoxification therapist. Kelsey graduated with a Master of Science degree in professional counseling and has background clinical experience with substance use and mental illness. She has worked in the Hampton Roads area since 2013, previously working in community agencies while specializing in treating populations with severe mental illness, domestic violence, substance abuse, and family systems involved in the legal system related to mental health concerns. Please welcome Kelsey Norton as she speaks about mental health related to alcohol and anxiety.
Hi, it's so nice to meet everybody. My name is Kelsey Norton. I am a therapist at Riverside Behavioral Health Center. And part of the topic today is the relationship between anxiety as well as alcohol abuse specifically. For those of you who wanted to, I would definitely open to having questions or any interactions during this. So please feel free. I will repeat your question just so those who are streaming can also hear what your questions are. All right, so alcohol and anxiety. Does everybody know what anxiety is or ever experienced anxiety? Probably all of us. All right. So what is anxiety? There's actually three main types or categories that we could break down about what anxiety is. But it is the brain's way of reacting to stress and alerting the individual of perceived danger. A little bit of anxiety can actually be a very positive thing. If anyone's ever felt real anxious, maybe the night before a big interview or something really important, and it's your brain's way of saying, hey, pay attention, this is important, right? So we could call this state anxiety. This is type number one, where it's a temporary emotion that occurs in response to situational events. Again, feeling anxious when taking a test is a good example. So most people do experience anxiety. It's a very normal response based on our stress levels that most people do experience multiple times during their life. A second type of anxiety would be considered trait anxiety, which is a more consistent tendency to experience negative emotions, such as fear, worry, across many situations. For some people, this can be like a personality trait. If anyone knows anyone who is, you could very much define, oh, they're very worrisome. For some people, it doesn't really matter what the situation is. They're more prone to feel some anxiety, some worry consistently, and not really having the natural ability to cope with pretty much everyday life circumstances. The third one, which is going to be more specific to needing more clinical treatment, is going to be anxiety disorders. Has anyone ever heard of like generalized anxiety, panic disorders, panic attacks? Yeah. For some people, things like panic attacks can actually present. Some people feel they're like a heart attack because they have similar symptoms. And for a lot of people with anxiety disorders, there are several different causes of them. For some, this could be related to more genetics. For a lot of people, it can be trauma-based. People experience something traumatic or even complex trauma. And then from then experience significant anxiety that impairs the way that they function, the way that they behave. So this could also be defined as persistent potential for progressively worsening symptoms. We call this an illness. One of the reasons is it can be chronic. For some people, it can get worse and worse over time. For a lot of people with anxiety disorders, there are plenty of ways for them to live a healthy, happy, functioning life. But this may require things like ongoing therapy, sometimes medication management based on an imbalance that they have in either in their brain or in their nervous system. So what is happening? What is anxiety? For us, when we usually experience anxiety, sometimes it can start external, sometimes it's internal. But typically speaking, the way that our brain works is that when we perceive something, when we see something, it starts in this part of the brain called the amygdala, which is the emotional processing part of the brain. it sends a signal to something called the, let's see if I can pronounce it right, the hypothalamus, which is the command center for the nervous system. So pretty quickly, when we experience something that causes anxiety, a car that merges in front of us, it is a quick response. If someone were to start chasing you, it's an immediate response. You don't have the time to sit there and think, hey, should I feel anxious about this? It's very quick. And this gets sent to our nervous system. One of the big functions of how our body works is our autonomic nervous system. And this has two major components, something called the sympathetic nervous system and the parasympathetic nervous system. And this does affect our bodily functions. When people get anxious, we have a way that it feels. Does anyone know how anxiety feels? What are some physical symptoms that you might have? Does anyone know? Yes, increased breath, heart rate that goes up, absolutely. Yeah, feeling nerve, like the jitters, right? Yeah, it's not a good feeling. Sometimes people get sweats, racing thoughts sometimes. For a lot of us, it can disturb our sleep. There's a bodily response that we have to anxiety. So there's two major components, like we said, the sympathetic nervous system and the parasympathetic nervous system. And this has a lot to do with what causes anxiety, but also where we kind of see some issues with our body processing that stress. So what is stress? Stress can be a hormone. Epinephrine or cortisol are going to be two main ones. Epinephrine is actually something we more commonly associate with adrenaline, right? If anyone ever heard of the example of like a pregnant woman able to lift a car off their child, things like that. A little ridiculous, but the idea is when we have so much adrenaline, your body is seeking to preserve you and to keep you safe. And a lot of times, this isn't meant to be a long-term thing. For short periods of time, it can be very essential in helping us function. Your body really seeks to preserve you to be resilient, not necessarily to always keep you happy. And cortisol is another main one, and this is another stress hormone that we experience. When we experience stress, when we perceive it, and we have that immediate reaction to it, it triggers our sympathetic nervous system. Had anyone ever heard of the fight or flight response? And it's commonly used phrase, yeah. It releases energy and helps the individual prepare for action. We call this, again, the fight or flight. So when I experience something that makes me stressed out, it's your body saying, hey, be alert, and let's do something about this. And for a lot of us, that can be really important, right? If I'm in a threatening situation, this alerts me and say, hey, all of your attention needs to go directly to whatever this is, right? If we're in this building and the fire alarm were to go off, immediately we'd all say, all right, let's pay attention and let's get out, let's be safe. And that's very positive. Now, where this can be problematic for those with anxiety disorders is that they're constantly in this like fight or flight feeling. So in that example I just gave of the alarm going off, if that alarm were constantly going off and we couldn't leave and this was just a part of normal life, how frustrating would that be? You wouldn't be able to really eat right or sleep right or pay attention. It would very much disrupt the way that we focus, the way that we function. And for a lot of people with anxiety disorders or severe, again, anxiety issues, this is part of our body that's dysregulated. The second part of the autonomic nervous system is the parasympathetic nervous system. So this is actually super essential because once I'm in that fight or flight mode, what helps me come back down and calm down? And that's this section of our nervous system. It acts kind of like a brake. It helps calm the body down after the threat has passed, and it helps us support rest. So once we said all those symptoms of having anxiety, including maybe heart rate increased, maybe feeling that nervousness, our blood pressure can go up, it changes the way that our body functions. This part of the nervous system helps us calm back down and bring us back to calm. Now, can you imagine if this part didn't work or work right, and you were constantly in that fight or flight? What do you think would happen? Or how do you think that you would start functioning? Would that affect the way you live? Constantly feeling anxious, feeling stressed out, and no way to bring yourself back down. What do you think a lot of people do when they're constantly in this stressed out state? Eat? Yeah, stress. Absolutely. Stress eating is a big thing that people do. That's absolutely correct. Maybe constantly moving. Right? Yes. And we're absolutely going to come to that. I heard one more thing. You said isolate, I think. Oh, isolate. We could. Yeah, we are typically looking for a way to deal with this. Usually people who experience this recognize this isn't how I'm supposed to be, and I'm looking for something to bring me out of it. So a lot of people coin this term like self-medication. A few of you said drinking, which of course is a part of this presentation. But yeah, absolutely. Alcohol. Does anybody know why people might drink when they're constantly stressed out and needing a way to cope? It's nervous system depressant? Yeah, absolutely. So good answer, because according to the National Institute on Alcohol Abuse and Alcoholism, around 66 million people, or million Americans, report binge drinking the last month. Does anyone know what binge drinking is? Binge drinking? Say again? Or a weekend binger? Okay. Part of my role as a therapist is, some of it is psychoeducation on what is substance abuse? What does it mean to abuse a substance? You know, for a lot of us, alcohol, perfectly legal substance, plenty of people drink it and don't have issues with it. It doesn't affect their life. They're not drinking to cope. But with this substance that is readily accessible for a lot of people who don't have any other coping skills, it is very common to know, hey, I get some kind of reward when I drink, I feel better. And binge drinking usually for men is about 5 drinks in an hour or 2, and women about 4 drinks. So that could be 4 shots of liquor, for example, 4 maybe 5-ounce glasses of wine, 4 beers, things like that, within a short period of time. And we know we have a culture of heavy alcohol abuse. We know a lot of people do this. So this statistic probably makes sense. For anxiety disorders, we know this is actually super common. So not just the normal everyday anxiety, which we called state anxiety or even trait anxiety, but a lot of this is anxiety disorders, mental illness. Very common, one of the most prevalent mental disorders for Americans. About 1 out of 5 people use alcohol to cope with anxiety symptoms. That's probably someone that we know if it's not something that we've experienced ourselves. An estimated 31.1% of US adults experience an anxiety disorder at some time in their life. And that's from the National Institute of Mental Illness. More than 14 Americans have developed alcohol use disorder. So alcohol use disorder is actually considered a chronic illness. It's a medical diagnosis, and this has a lot to do with dependency, which we'll talk about in a moment. But as you can see, such a huge amount of people who not just use alcohol, but also would be considered abuse of that substance. We're using it not as intended. Now, why do we do that? Well, alcohol has about 3 different components to it. We've all probably had alcohol before. When we drink alcohol, there's a reason it relaxes us. Sometimes a question I ask people, say, hey, if we call alcohol a depressant, but I drink it and I feel good, right? How does that work? Well, in small doses, alcohol is stimulating. It triggers the pleasure center of our brain. It affects dopamine levels and adrenaline. So we get reward from it, right? It makes us feel good, we're relaxed. It affects our nervous system in a positive, it feels like a positive way, right? Another positive thing that I get is actually called negative reinforcement, but in small doses also, it takes away stress for a small period of time, contributes to the likeliness that the individual will repeat consumption. After I've had 1 glass, I might be more likely to say, hey, I'd like another, or to repeat this behavior consistently, right? And for a lot of people who drink appropriately, moderately, this is maybe what we're seeking. For social drinkers or people hoping to achieve a feeling, we're trying to achieve euphoria. For a lot of people looking to cope, we're trying to avoid something specifically. When we abuse alcohol, however, it has a punishing component to it, and it becomes a depressant in large doses, has a sedative effect. So we know when people drink too much, sometimes they black out, it sedates them. When people drink to go to sleep, it actually just sedates them. A lot of people don't enter that REM cycle. It causes fatigue, blackouts, memory loss, and impaired decision-making. And we think we all know that. DUIs, drunk driving, drunk in public are some legal consequences that people have from this punishing effect, right? We know that it causes memory loss. A night of heavy drinking, I might not remember what happened the night before. It changes our behavior with other people. It has a lot of negative consequences. And these are all things that most people do acknowledge. So we said at the beginning, there are, let's say, 4 main reasons why people drink alcohol. Social use. We know there's a big social component to drinking. Most events or holidays, for example, in America especially, involve alcohol use. Enhancement of feelings. I'm celebrating something maybe. I want to feel better. It's my birthday. I want to drink. It's Christmas. It's whatever special event. So wedding, we're going to toast. It's an enhancement of that feeling. Conformity. And this has a lot to do with people feeling that peer pressure to drink. I'm at an event, maybe I'm trying to stay sober. However, I know everyone's drinking and there's a good chance that I might drink as well. Maybe to seek a feeling of acceptance, to not be the odd man out, feelings like that. And then the biggest one that we're talking today is number 4, which is coping. And this, has the specific emphasis on, I am seeking to avoid a negative feeling, which might be stress or depression. Seeking the negative reinforcement, which you talked about in this previous slide, which is taking away the stress for a small period of time. Again, it contributes likely to the reason I'll use again. So when people drink to cope, how often do you think this might turn into a significant issue? Yes, ma'am. Yes. Do you think this can become a significant issue? Absolutely. So say yes. All right. Yeah, absolutely. So individuals with anxiety disorders are more likely to drink to cope with strong emotions. At the beginning, we discussed about what it's like to live with anxiety. We know most people do experience some state anxiety pretty consistently. I might experience anxiety in traffic on the way home. I might experience some anxiety with hearing bad news, things like that. However, anxiety disorders where it's not manageable, we know this does affect a large population here in America. These individuals have a higher risk of having alcohol-related problems, including development of medical conditions such as alcohol use disorder. Alcohol use disorder, it's both a physical and emotional dependence on alcohol. If anyone has ever interacted or maybe observed alcoholic behavior, a lot of my patients as the detoxification therapist are specifically going through alcohol withdrawal, and that does bring a lot of people to the hospital. This can be as severe as having tremors and shakes. Sometimes when people have, I think we called that the hangover anxiety earlier, where we don't feel good and it drives us to continue using. Anytime that we have a mind altering substance, the more that we use it or abuse it specifically, our tolerance can increase, leaving the likelihood that we could develop a dependence on it. So with alcohol use disorder, it's a more extreme version of abusing it. There's actually what we call a chemical dependency. And that's both a physical dependency, so that could also include cravings, having strong urges to go drink. We know that with alcoholism or this disease, people continue despite negative events. They can't control their use. But the biggest part of it, that part of our focus will be on, is the emotional dependence on alcohol. And this is what we've been discussing in terms of our nervous system. I am seeking to get rid of this feeling. Something's not working. And my coping skill, my go-to coping skill seems to be, if I drink, I do feel better. And a lot of this we know is problematic because any logical adult can tell you, but it only works for a short period of time and it gives you more negative issues afterwards. So what drives me to keep going? The self-medication hypothesis of addiction. Individuals using alcohol or drugs specifically to alleviate dysphoria and change our emotional state rather than seek pleasure. For a lot of people in addiction, regardless of the substance, maybe at the beginning it starts with seeking a certain feeling, seeking to get high, seeking to get intoxicated. For a lot of people, as this disease continues and becomes very vicious, it's more about not really getting high, trying to get well. I don't want to have this feeling any longer. And it becomes really severe to where the only thing that my brain can seem to focus on is getting rid of this feeling. There is short-term gain. When people relapse, they immediately feel better. but there's long-term exacerbation of symptoms. Now the cycle has started all over again. I'm now met with more anxiety, more issues because of it. Part of how our body works too is that when I drink alcohol, we know it pushes down those stress chemicals or hormones. We said cortisol was one of them. And in the time, I feel better. But our body also says, this isn't normal, and it actually overproduces because it's seeking homeostasis, homeostasis and balance is what it's seeking. And so when that substance leaves my body, I'm now met with more anxiety, more stress, right? And we can kind of see how this becomes really, really problematic in that vicious cycle. Again, this leads to the development of chemical dependency over time. And alcohol, depending on the person, but this can happen to a lot of people. There's symptoms that make it more prone to others. Having an anxiety disorder is definitely one of them. So the psychological and emotional dependence, again, the more that we abuse alcohol, meaning binging, drinking to cope, for example, increases our tolerance. If anyone knows anyone like this or has experienced this, drinking to cope, maybe after work, I needed 1 beer, and now I've been doing this for a long time. Now it takes a 6-pack, and then it takes 2 6-packs, right, over time. And we can see how people drink to the extent that they do. So alcohol, like we said, is a depressant to the central nervous system. We have short-term gain, which is the negative reinforcement. It slows down brain activity, however. So we get that drowsy or calming effect. And this is where a lot of people start drinking to be able to fall asleep because their anxiety is so high at night, their body cannot naturally enter that calm state that allows them to rest. It alters, we know, of course, it alters mood and behavior. Self-perpetuating problems, however, anxiety can lead to repeat alcohol use. And part of that is we do get some pleasure or some motivation from using. We know that alcohol tastes good. It's an acquired taste for a lot of people. And there's that immediate effect where, hey, I feel more relaxed. I feel better in the moment. And that pleasure center is still activated. There are changes to the physiology of the brain and depletion of what we call those neurotransmitters that promote the parasympathetic nervous system, which we said earlier has to do with calming us down, right? In a healthy body, that allows us to not only experience anxiety, which can be good, but also bring us back down to that calm state. Anxiety disorders, especially if I maybe had some anxiety issues and I've been abusing alcohol, it can create substance-induced anxiety issues or disorders. Increased consumption and abuse of alcohol, like we said, does lead to that higher tolerance, which can lead to a likeliness of emotional dependency and addiction problem potential. So emotional dependency, over time, the brain and nervous system come to rely on alcohol. So imagine if I've been using alcohol to cope, to function. For a lot of people, we don't even have this understanding of what I'm really doing to myself. For a lot of people, it's a part of my behavior. We know that it's a social norm. It's very much a part of our society to, after a stressful day, to drink to avoid those feelings and change those feelings. And now there's a reliance on it. Part of what we said earlier with the dependency that can happen is now I've lost that ability to cope. I'm not able to self-regulate any longer. And a lot of this has to do with, again, my nervous system that is not able to handle stress. So stressors that maybe a long time ago, I was able to manage, I was able to function and deal with on my own. Now I have very low distress tolerance. Chronic use, when drinking is stopped, increased stress levels and cravings are created, and the individual feels compelled to continue using. So this is actually a lot of the demographic that I work with at the hospital. For a lot of people, we know this illness is chronic. Once they need that level of care where they're consistently being hospitalized or needing a higher level of treatment related to alcohol use, for a lot of us, a big part of what causes them to keep using isn't really just cravings. It isn't just knowing this isn't healthy. We know what the consequences are. We know, we call addiction predictable, and we know it's going to happen. But for a lot of individuals, they actually can go through something called post-acute withdrawal. And that's where I've gotten over the physical side of it. And now a big issue that keeps causing relapses, or where I'm struggling to stay sober, is the long-term anxiety effect or mental health issues. For chronic users, this can last maybe a few months. For some people, this can take maybe a year and a half or longer sometimes for their body to return to normal. And for individuals without other coping skills, if I only had the one coping skill for so long and then stopped and didn't replace it with anything else, I'm not going to be successful, right? And this is where a lot of our population is, a lot of people that desperately want to get sober, want out of this vicious cycle, want out of not feeling good ever, and want something different. But this is a huge barrier for people. I asked you guys at the beginning, who's experienced anxiety? I think we all said this is not a good feeling. We've experienced in small doses. Imagine experiencing that all the time. It's awful. So where do I start to get help? Before I go through this slide, I want to ask you guys, what have you ever experienced this or maybe known someone? Where would you say, hey, maybe get some help? How would you know if someone was dealing with this and needed different ways to cope? Yes, ma'am. How would you recognize in your personal life if someone was drinking to cope? Okay. Absolutely. So she's recommending Alcoholics Anonymous, which we know is a peer-led community group. And it's the whole purpose, there's a whole program that they work through, but it's a lot of support to help with, especially that early recovery. Yeah, that's wonderful. Yes, sir. Than what we treat at the hospital? Good question. So he's asked if alcoholism is different than what we treat at the hospital. So alcoholism, what we're calling alcohol use disorder, right? It's the chronic illness. We know it's a disease. It can be a lifelong symptom or issue for people who don't actively get into treatment. Very similar to another physical chronic illness. We know that the earlier that we treat it, the better the results can be. We know it's a disease that comes back, and when it comes back, it can come back worse. We call it a disease that goes into remission when someone gets sober. However, the brain pretty much always remembers what it's like to use. So with alcoholism, the lady in the back recommended AA groups, and a lot of what they teach is that recovery is for life. Because for those of us that are maybe in recovery or dealing with alcoholism, some of these issues I might constantly have to now deal with and cope with differently. So at the hospital, we're a very acute care where we treat people specific to kind of like that crisis mode where people are going through withdrawal symptoms, where they've been binge drinking and are at the point when they can't deal with it on their own any longer. And they need medical support, which can include medication management, therapy, dealing with not just the physical side of it, but definitely that emotional dependency as well. So that, yes, that is alcoholism. Thank you. Gotcha. Great question. So you're asking if people who drink alcohol like this specifically, if they're also, is it being prone to use things like tobacco or other substances? Okay. Yeah. Great question. So there actually is a high relationship between alcoholic use as well as cigarette use. If anyone has ever smoked a cigarette, and if you've ever heard this where people say, hey, I'm feeling really anxious, I just need to have a cigarette and calm down. And so a lot of this, that similar concept. And with that specifically, it's not so much, and it is, I feel like I'm treating my anxiety, but a lot of, even with addiction with nicotine, even though it's also a legal product, when I go through withdrawal, that post-acute withdrawal, my brain remembers, hey, I know it's going to calm me down, even though we know it's not actually treating anxiety. In the moment, it meets that need, it meets that craving, and we calm back down. With other substances, while they impact the brain or the body a little differently, the concept is the same. And for a lot of individuals wanting recovery that have been using not maybe just alcohol, but other substances as well, they're going to experience similar experiences in earlier recovery, meaning heightened anxiety, specifically issues with mental health during that post-acute withdrawal. Something that is really interesting for people not wanting to drink, not wanting to be in an active addiction any longer, is something we call cross addiction, where when I stop drinking, but that's been my coping skill for so long, and now it gets channeled into something else. A really common substance now is marijuana, where maybe I've been drinking for so long and now I can't cope with my anxiety still, but I want to stop drinking. And so a very common thing now is using THC or marijuana. Yeah, great question. So for, yeah, absolutely. So there's different type of addictions. Specifically, we're talking about like a chemical or like a mind altering substance. What you're referring to is, and I'll repeat your question, is if I have it, let's say we call it an addictive personality, and my drug of choice, maybe it was alcohol or something else for a long time, and then I got sober, but I channeled that into something else, like gambling, sex addiction, maybe shopping, or other high risk behavior. And a lot of it still has the similarity is the pleasure center of the brain, where I'm seeking something, getting that same reward. It affects my body differently. But yeah, there are some big similarities. And I definitely see that in my population where, the kind of the baseline is, I don't know how to deal with these feelings. And so I'm going to channel that into something else. Yeah, great question. So for a lot of us, if I recognize that this is a problem, and for a lot of people, it takes a long time to recognize that this is problematic. We know with alcohol, like we said, we know it's legal. Plenty of people do it. In the statistic we gave earlier, millions of Americans consume alcohol every day and abuse it. In addition to, the family structure. If I grew up in a household where alcohol was abused frequently, and it was seen as a norm, nobody saw it as problematic, I may not initially be inclined to change. Has anyone heard the term like a high functioning alcoholic, right? I don't really believe that's the thing because I might be able to maintain my job. I might be able to maybe maintain relationships or pay the bills, things like that. But at the end of the day, we know what this chemical is doing. It is going to change the way that we function at some point, and it does affect our mental health. But for a lot of people, getting help is such a hard start for people. Recognizing that there is a problem. Step one, we say acceptance, right? Recognizing that I need help and I don't have power over this any longer because I don't have other coping skills. Many individuals struggle with attempting sobriety due to not knowing how to manage underlying or remaining anxiety levels and uncontrolled stress. Counting the stress response, such as physical activity, relaxation responses, and social support, can help initially with that. But like we were saying, initially knowing how to cope is very difficult for some people who maybe never had other coping skills. Having natural distress tolerance is a skill. If anyone ever had children, and the ability to self-soothe comes with time. It's not something they normally get by themselves. It's something that's taught. And as adults, we can be very similar, where we're in that state of anxiety, in that state of panic, and I don't know how to bring myself back down and self-regulate. At the beginning, we discussed the parasympathetic nervous system. A lot of treatment and learning how to cope is learning how to activate that part of our nervous system. So there are some basic coping skills that really do support this. Physical activity, we know actually should be a part of our natural life, our lifestyle. It helps regulate and produce different endorphins, different emotions, neurotransmitters that can help regulate this. Having social support, we said having something like AA can be a huge benefit. Having other people that know what we're going through and can support us and kind of coach us through that process is huge. For a lot of people dealing with mental illness or addiction, or something that we've been talking about, which is a co-occurring diagnosis maybe. For a lot of us, the two big things they have in common is that they're very isolating. People with mental illnesses, people with addiction very much get cut off from those around them, healthy support systems, maybe not knowing how to access resources, things like that. And we lose sense of purpose, feelings of hopelessness, and it becomes a broader sense of issues that we develop at this point. And having social support is huge. It's a huge step in the right direction in order to help engage us in our treatment. So for a lot of people, like we said before, for most individuals, there usually is an underlying mental health issue that leads to addiction. I say all the time, nobody just wakes up, has a great life, things are wonderful, and decides, yeah, I'm just going to become an addict today. Typically doesn't happen, right? So addressing the causes of anxiety as well as dependency on alcohol is essential. For many, other interventions may be needed for long-term success. So the question I asked earlier was, how do you know if someone's having this kind of problem? What do you recommend? For some people, when they're having difficulty doing this on their own and making changes and having them stick, being successful, for a lot of us, we may need a higher level of support. So the example I also gave earlier was about with a physical illness, right? Let's say cancer. If I had cancer and I went to my doctor and the doctor said, hey, this is what's going on, but with surgery, we can remove it and you can get into recovery. And if I were to say, hey, I'm just going to read a brochure and not hang out with people who have cancer, that wouldn't work. And we all know that wouldn't work. And we have to have this similar approach for people with addiction or with alcohol abuse issues, even though sometimes we don't always see it. This is where just step number one, having a physician can be very beneficial. We know that doctors are unbiased. They're going to tell us what we need to hear, right? They're not our friend. They're going to tell us, hey, this level of drinking is problematic. These are the physical issues that may happen. These are the mental health issues that may happen or have already happened. We know that there's a lot of physical health issues with alcohol abuse, elevated liver enzymes or cirrhosis, pancreatitis, kidney diseases. We know it affects our brain. It can actually cause like an early onset of dementia. It affects our sleep. It affects our skin. There's a lot of physical health issues. And for a lot of people, just being honest with your doctor is hard, but it's a first step in saying, hey, this is actually something I'm dealing with. How do I get some help? Physicians have great resources and can always provide referrals and give you some knowledge on step number one, how to get some help. As a therapist, I'm really a promoter of therapy. I think therapy is for everybody, but there are different types of therapy. Therapy is not just about talking to somebody or having someone to listen to, even though that's positive. But a lot of therapy is clinical treatment. It's clinical work. And two main styles of therapy or specialties. We call this trauma-focused or maybe DBT. And the focus of these types of therapies is on regulating the nervous system, increasing emotional regulation and distress tolerance. So this whole time we've been talking about for a lot of people who are coping, trying to cope, and a lot of the root problem is a dysregulated nervous system where I can't deal with this anxiety, with these emotions on my own. So for distress tolerance, let's say I'm in early recovery and things keep happening and I keep getting stressed out, and it doesn't take a lot, and I can't seem to self-regulate. There's skill building exercises and a style of treatment that focuses on increasing that tolerance, being able to self-soothe, self-regulate. For a lot of people, and this is a big belief of mine, that most people with addiction have experienced trauma of some kind. And that could be, for a long time, we had this idea that friends who went through war that have trauma. And yeah, that can be true, but there's such a greater aspect of what trauma is and how it changes us. I like to define it as something incredibly stressful that from then on changes the way that we function. And this could be one big event. This could be lots of smaller, complex events that happen. But ultimately what it does is it changes the way that we, like we said, we function, where my stress, my depression is so out of control. My nervous system does not work the way it's supposed to on its own. Sometimes I don't know what it is, but I feel unsafe in my body a lot of times. Even though I maybe subconsciously don't know what the issue is, I just know I can't cope. And so a big style of treatment is actually what we call like a trauma-focused or trauma style of treatment that really helps individuals long-term regulate their nervous system and address some of those traumas so that they're not so impacted or impaired by it down the road. And this actually for people getting sober can be a huge step in maintaining that sobriety, working on those deep-seated issues. We mentioned having support systems. This can look like a lot of things. This can look like a 12-step meeting. This can look like our providers, maybe case management in the area, friends and family. There is no one size fits all. For people, this can look different, but we know there's a much greater likelihood of being successful long-term, having people around you, that it's actually a safe support system. For some individuals, medication-assisted treatment may be a good option. Not for everybody, maybe. However, but medication, we know, depending on what you're taking for anxiety, for depression, for other mood disorders, maybe, medication might be life-saving, and it might really help us with recovery, with stability. There are lots of anxiety medications that help people say, hey, I don't actually have that urge or that craving to keep abusing alcohol any longer, which is really positive. And then something I'm going to briefly discuss is what we call the American Society of Addiction Medicine, which is a big part of what I do. And there's different levels of treatment. The gentleman over here asked about alcoholism and how we treat that at the hospital. And this is a big part of our module. At Riverside Behavioral Health Center, there are several different levels of care. For someone in active addiction who needs help and can't physically stop on their own, for example, and this is kind of what alcoholism is, we might need a medical intervention. We know that with alcohol abuse, with chronic alcohol abuse or other substances, right? This can cause, like people who overdose, for example, with alcohol, people have seizures sometimes when they just stop drinking, and this can make them hospitalized. And so at the regional medical center, we've had patients who have drank themselves into a coma, for example, and need that 24/7 medical support. Where I work at this facility, we have a lot of individuals who have really high blood alcohol contents. So for example, the legal limit is 0.08. And for much of our population, it's 0.2, 0.3, 0.4, 0.5 or higher. And for these individuals, it is incredibly dangerous for them to be at home and to stop drinking because of, again, the withdrawal symptoms primarily. But also, if I stop drinking and I get over the cravings and the withdrawal within a couple of days, what most people experience, and I call this part 2 of that first stage of detoxing, is the emotional drive. It's the high anxiety, incredibly high anxiety, really strong cravings that we also provide support for. Part of what we do is not just the medication management. There are nurses 24/7. I meet individually with patients, help work on some skills and some tools to help them through that process. I do a lot of group therapy, a lot of psychoeducation, and also skill building to help rebuild and re-regulate our nervous system just at that initial stage. Now, from there on, we know a lot of patients have probably been going through this for a long time and still need continued support after that 5 or 7 days in the hospital. And from there on, if anyone's heard of rehab, yeah, everyone, the Amy Winehouse song. It's a 30-day program, give or take, where we are in treatment, getting a lot of therapy, working on maybe some more specific skills, but also during that 30 days, that's where we have, again, more severe cravings and more severe mental health issues. And having an inpatient facility where I'm supported, where I don't have access to something, so I am sober, right? And having, again, all the other support systems, treatment styles that we might get in inpatient facilities is really essential for a lot of people. Once we leave, for a lot of people, of course, I'm going to stay sober in rehab because I don't have access to it. And we need to learn how to transfer those skills into the community and being back home. And that's where we offer partial hospitalization, which is kind of like day treatment, where our patients come from about 9 to 3. They have group and individual therapy. They get connected with a lot of wraparound services. They still see a provider each week, which is important for people on medications, anti-craving medications, anxiety medications, and to still have that kind of support, as well as really usually involving the family, involving the community, help get them connected and utilize all those skills that they had learned with where they're at now. Usually partial hospitalization is anywhere from maybe 4 to 6 weeks. And they're stepping down once you've graduated successfully to intensive outpatient, which is about usually 8 to 10 weeks, and it's just group therapy. And it's not as many days during the week. And at the end, we continue to encourage people to continue with things like AA and things like individual therapy and their medications. Like we said earlier, with people who have experienced traumas and things that have severely disrupted their life, their way of functioning. Trauma therapy, for example, can be a long-term thing that we work on. We know most issues didn't just occur overnight, and they're not going to be fixed overnight. And that's where continued treatment is. But with this module of treatment, the ASAM levels of care is give or take 4 months. that people go through, there's significantly high statistics that can show a lot of success with people who complete this, again, style of treatment. Are there any questions? Several. Okay, we're going to start here. Yeah, so you're asking about other mental diagnoses such as ADHD, ADD, other questions like that. That's a good question. Something like ADHD, we know it's typically probably genetic. There is medication management. There's some evidence that shows that people with maybe ADHD, for example, who going without medication, without any kind of treatment or intervention, have a higher likelihood of also self-medicating. So, most of our patients do have more than one diagnosis, comorbid disorders. ADHD specifically, our brain function is just different. And then someone who does not have ADHD. So the treatment is actually going to be a little bit different, but there is that likelihood of being untreated with this diagnosis. There's a higher likelihood, not that you will, but there is a higher likelihood of self-medicating. Yeah, great question. I think, yes, sir. Perfect. Yeah, so he's asking if at RBHC, if we treat other things besides alcoholism. And yes, absolutely. We have different units and different specialties. We do treat both substance uses as well as alcohol being one of them, but other substances as well as just psychiatric issues. We have other units that are more for people going through psychosis, more severe mental illness like schizophrenia, for example. People who are suicidal is a big part of our population. So there's a lot of issues that bring people to hospital. Again, one of the things that we see though is the tendency of self-medicating, despite what the mental illness is. There is a higher connection between, okay, I have bipolar, I have major depressive disorder, and I'm self-medicating. So you're asking what substance is most specific in this area? So that's actually a good question. We know things like cocaine, the way that they're kind of trafficked into different ports coming from, let's say South America is a really big population for making cocaine and transporting it through cartels. The Eastern Seaboard is a big risk for things like cocaine. In Hampton, Newport News, there's a huge crack cocaine problem that we have, like an epidemic. As far as the opiate epidemic, that's been going on for maybe 20 or so years. That's a problem a lot of places. There's some different issues related with that. Alcohol is one of the bigger ones that we see at the hospital, specifically because of the withdrawal symptoms. That brings a lot of people needing treatment. I need medical assistance. With other substances, it's not as dangerous to detox by yourself. Heroin. So with heroin withdrawal, you feel like you're dying, but you're not actually going to die unless it's an overdose. But it's the two things that could potentially kill you from withdrawal is actually alcohol and benzodiazepines because of the risk of seizures. So it's a great question, though. Yes, ma'am, in the back, and then I'll come to you. Oh, good question. So she says, after patients go through this, what is your percentage of success? So there's a much higher likelihood of success going through all 4 stages of the ASIN levels of care. I myself don't get to always see that, for different reasons. Probably the best way to phrase it is when we're talking about a chronic illness, we're also talking about the chronic need for treatment. For a lot of my population, a lot of the population, fortunately, but the one that I see the most is our population that's constantly in that crisis mode, where I'm using, I get to the point when I can't do this any longer, I come to the hospital, and there's a small window of time when that closes back up again, and then I'm back out using again. So that's a lot of what I see. What we do offer at Riverside is, besides rehab, we offer the other levels of care. And what is really cool is seeing patients who maybe I get first, and I help them through that detox process, and then I see them successfully go through partial hospitalization and go through intensive outpatient. And sometimes we'll come back for aftercare appointments, and that they're really doing well. The statistics for addiction to success rates are low, just the nature of what this disease is. So I don't know that I could give you a very accurate answer. But a great question. I like it.
And I know how it's affected this person.
Yeah.
As a result of COVID and
Yeah. Oh, that's a great question. So she's asking how has COVID affected alcoholism, anxiety, inability to cope with anxiety. So actually, the pandemic is a great example of complex trauma, of people going through a long duration of a period of time where we're constantly under stress from everywhere, right? From politics to health issues to what's going on with no toilet paper, whatever all these issues are. And we're constantly stressed out. And that's a great example of, like we said, a complex type of trauma. So yes, we actually, the past couple of years, there have been huge rates of increasing anxiety issues as well as addiction issues. I've had a lot of patients that said, this was never a problem with me. I was always just a social drinker. Nothing was ever problematic. And then I was locked in my house. I just had my kids. I had no support. And Uber now takes alcohol to my door, you know? And yes, so to answer your question, yeah, COVID has had a big impact on this concept of self-medication, you know, especially for individuals where everything went virtual. We know that for a lot of populations, this is hard for people, people who don't have access to technology or are just not technology really proficient in it. And it's really hard for people. I don't even like Zoom sessions that much because I like to interact with people and I don't feel connected to you when you're on the camera, you know, and that's a lot of people, that feeling of loneliness. As well as maybe I went to my AA meeting for years and was doing great, and now it's online and I don't have that accountability any longer, you know? So yeah, we definitely have seen a lot of issues that related because of the pandemic. Things are getting better as we're, you know, coming out of that, because we're human beings and we were made for connection. And that really was a big disruption to that. Yeah. Yes, what did you have a question? No? Okay. Is that it? Oh, yes, sir. That was you. Okay. Yeah. Oh, great question. So you're asking how, and oh, that's a huge question. We ask that question every week at the hospital. Yeah. Oh, absolutely. Absolutely. Our most vulnerable population. So the question is, how has this affected, or how do we handle situations where patients, our population that doesn't have insurance, doesn't have the financial or social means? And this is where, you know, we do see that privilege has a big role in how people get into recovery, you know. Thankfully, Medicaid has expanded over the years to where more patients can have access to that. There are a lot of great rehab programs that accept Medicaid where it's covered for them. But that's still a challenge because we absolutely have individuals that come to the hospital that don't have insurance. Maybe there's a slight technicality why they can't get Medicaid and they're in that really tough spot. And that is a lot of people. And, you know, there are always resources. AA is for everybody, right? There are places, community service board, there are places that do like pro bono work. But you're right, having in different insurances or different support systems, financial assets does make a big difference. At the end of the day, though, you know, I see success stories from people with the hardest of circumstances, and I see individuals with all the resources in the world who never make that change. You know, there is, while we call it a disease, there is a level of what role that we play in our recovery, both mental health as well as addiction, and our internal drive for that. Cool. Is that everybody? Awesome. Well, thank you so much. It's been such a pleasure to speak to you all today.